Hello, I'm Dr. Gil Wilshire at Missouri Fertility.
And I'm Kimberly Ritter, RN, BSN, Surgical Coordinator.
Today we're going to be discussing your preoperative preparation. At this point, you've probably had a chat with us about having surgery. We've probably discussed the risks, the benefits, and the alternatives, and we've all decided that surgery is a good idea for you. Most of our surgeries will be laparoscopic or minimally invasive, so your recovery should be very rapid. Some of you may be having a larger incision and a larger surgery, and obviously your recovery will take a little bit longer. But our standard instructions go something like this. You're going to need a bowel prep. How do you like to do the bowel prep, Kim?
Approximately 2 days prior to your surgery, we would like for you to get a laxative magnesium citrate and drink that the morning of the 2 days prior to the surgery date.
So 2 days before the surgery in the morning, you're going to drink this bottle of magnesium citrate. I've heard if you pour it over some ice, it's all right. A little juice.
Yes, you can either put it in a refrigerator or just chill it a little bit and it is ready to go. It's about an 8 to 10 fluid ounce bottle. It's over the counter at any pharmacy. Just ask the pharmacist and they can help you with that.
Yeah, this bowel prep is not like you'd have for a colonoscopy. This is essentially just to get your bowels basically empty. We want you to have a big poop the day before the surgery, so you come into surgery basically empty, and then they don't have to go to the bathroom for a day or two afterwards either.
True. Perfectly. And after you consume the magnesium citrate, you can eat light that day.
Yeah, eat lightly. You don't have to be NPO or nothing by mouth, but eat fairly lightly the 2 days before the surgery. Now, the night before the surgery at midnight, what happens, Kim?
I like for you not to eat or drink anything after midnight.
Nothing.
And do not eat anything the morning of your surgery date.
That's right. They can brush their teeth, but make sure you spit it out, okay? You want to have an empty stomach. Now, the one exception is for medications, I believe.
If you should have any questions and or concerns, you will be seeing anesthesiologists and you will be seeing the nurse prior to your surgery date, which they will call you 2 days prior to.
That's right, and they'll be telling you what medications you might take the morning of the surgery with a small sip of water. That's okay, and they'll be talking to you about that. So you might need a blood pressure medicine, thyroid medicine. There's a few medicines they might want you to take. Most of them you will probably not take the morning of the surgery. Also in the morning of the surgery, please take a shower. We want you clean, okay? Don't have to put on fancy makeup or perfume or anything. Just come in clean with your teeth brushed. Okay. After the surgery, generally what happens, Kim?
Recovery time after the surgery, you can look at that anywhere from 4 to 5 days in terms of recovery. Post that time, after you see Dr. Wilshire for your post-op appointment, we will see you back in the office for that appointment like 7 to 10 days approximately.
That's right. And after the surgery, we will have what I call a debriefing visit. We'll talk about what we found, and we'll talk about future plans depending on what we found and what we accomplished. Most of our surgeries are minimally invasive, and recovery is generally very rapid. But generally, we like you to take it easy for at least 2 or 3 days after the surgery. Many women are going back to normal activities in 4 to 5 days, but as they say, your results may vary. There you go. So, Kim, thank you for your insights. It's wonderful working with you, and I look forward to doing another wonderful surgery here at Missouri Fertility.